Are you freaking out about your child's recent weight loss after starting an ADHD medication? Then watch the rest of this video, and I'm going to give you 4 tips and strategies on how to deal with it right now using the medications they're already taking. My name is Dr. Nate Noble, and I'd like to welcome you to the channel, where I give you 20 years of medical experience for 20 minutes or less of your time. That's a pretty good deal. Look, if you're watching this video, you're scared. You're freaking out because your child's been put on an ADHD medicine and they're having difficulty maintaining their weight, or they're losing weight because of the side effects of stimulant medications. If you don't know what I mean by stimulant medications, ADHD medicines, I'm going to put some links to some previous videos up here. Go watch those. They're going to be very helpful for you, okay? But if you're struggling with this concept, you're in good company. Listen, 9 to 15% of the population of children in America are going to be diagnosed with ADHD. And if we want to help those kids, the best way to do it, aside from academic interventions and 504s and IEPs, which I'll talk about in other videos, is really to address it using stimulant medications or ADHD medication. This is a 2-part series. Today I'm talking about what to do with the medications you're already taking to slow down weight loss. And in part 2, I'm going to talk about common dietary interventions that you could put in place to provide additional caloric input to also keep weight on your child. I'd also like to encourage you to stick around to the end of the video, where I'm going to offer you bonus material. I'm going to talk with you parent to parent about how to know when you should just stop giving your child an ADHD medication. There are some hard, fast rules, and I'm going to share them with you, so stick with me. Let's get started with our first tip. The first thing I want you to know is timing. Say it with me, timing. So many people don't understand timing as it relates to the medications their child are taking. Okay, let me break it down for you like this. ADHD medicines, or stimulant medications, come in 3 basic forms or timing schedules. The first of which is what we're going to call short-acting medicines. Now, these are medicines that last about 3 to 4 hours, a 3 to 4 hour duration of action. Okay, so these are medicines, and examples would be Ritalin, Dexedrine, Adderall, Focalin. There's probably some others, but those are short-acting, 3 to 4 hour stimulant medications, okay? And if you know the duration of action, it becomes easier for you to time the caloric opportunities that you offer your child. The second group of ADHD or stimulant medications are intermediate-acting agents. And these are less common, but there's a few that I really like, and those are medicines that last 6 to 8 hours, okay? And those are good for like the kindergarten, 1st, 2nd grader who you just want to treat during the school day. You want to use a once daily medicine. You don't want to do a noon dose and involve the nurse. Then intermediate acting agents can be really helpful. And those are medicines like Metadate CD, 6 to 8 hours of action. And then lastly, stimulant medications come in long-acting or extended release formulations. And those examples of those would be Adderall XR, Concerta, Daytrana, Focalin XR, Vyvanse, among others. So once you've considered the timing of your child's medication, there's another aspect to this that I want you to consider, and that's not only the duration of action, it's the onset of action. Not only how long the medicine lasts, but how quickly it starts acting. How do I know all this stuff? 2 reasons. I've been doing this for 20 years, but also I've taken all these medicines. And I will tell you, what I'm telling you is the truth. So you must understand that it takes about 30 minutes for the medication, once it's gone into your child's system, to begin to take effect. And when it takes effect, that's when side effects happen. So now that you know the timing or the duration of action of the medicine and timing in terms of onset of action, you can begin to understand the distribution of suppression, okay? Distribution of suppression. I just came up with that. It feels really good to say. And what I mean by that is the distribution of appetite suppression. Is it a 4-hour suppression, a 6 to 8 hour suppression, or is it a 12-hour suppression? And it depends on the medicine you're taking. If you don't know, ask your doctor or Google it. Ask your pharmacist. This information is readily available, and you must know it in order to plan accordingly. So now that you know this information and you've thought it through, let's talk about how it's useful for you. Knowing that it takes 30 minutes for the medication to work, it's very important that when you give a medicine, whether it's a short, intermediate, or long-acting agent, that you give it with food or after a meal. but don't give it 30 to 60 minutes before a meal, or the side effects of the medications will be kicking in and that child will not be hungry. Giving it with food also does two additional things. It enhances absorption and it minimizes gastritis, that irritation on the stomach lining, which makes it difficult for anybody to want to eat anything. Understanding how long a medicine lasts also gives you clues as to when you're most likely to be successful in offering snacks and food items. If it's a 4-hour medicine and you give it with breakfast or after breakfast, and you do the math, and you get to 11:30, the medicine's going to be wearing off, the kid's going to be less attentive, but their appetite's going to go up. You can offer them a lunch, right? Either at school or wherever they are, and hopefully it's a highly calorically dense lunch, which again I'm going to talk about in the second part of this video. And then you can give the second dose of the medicine, then you do the math again, and then 3 or 4 o'clock the medicines are going to wear off, and maybe you can get an after school snack and maybe an early dinner, maybe a second dinner as the night goes on. But you have to understand when your opportunities are going to be best. So another way to think about it is when your child's going to come up for air from an appetite perspective. So knowing how long a medicine lasts and how quickly it begins to act are two very important things for you to understand so that you can offer snacks and meals at appropriate times. But you have to also understand that if you're trying to offer snacks or meals at a time when you're underneath that distribution of suppression, you have to have realistic expectations. You can pack them the most beautiful bento box the world has ever seen. I mean, it can have some cherries and some delicious things and a little handwritten note and a little organic cookie, and you can do all that stuff and you'll feel great about it. You'll feel great about it. And little Johnny Pumpkins, which is the arbitrary name that I'm giving your child in this scenario, that's just what it is. Why did Pumpkins? Oh, it just feels good. Right? They come home and they're going to bring all that food home in their beautiful little bento box and nothing's going to be eaten. Okay? Don't feel bad. Don't feel like your child's going to waste away or you're just going to see their ribs and it's going to be this terrible, scary thing and they're just going to, just kind of melt away in the ether, the abyss of academic success because, they don't eat. That's not going to happen. Okay? So understanding the duration of the medicine and the timing in terms of when it starts working gives you a strategy that will help make you successful in keeping weight on your child. Okay, now let's move on to tip number 2. Tip number 2 is very simple, but a little bit counterintuitive. I've been doing this for a long time, so that's how I know that this is sometimes a good strategy. Sometimes the best thing to do is to stop the medicine you're taking and pivot or transition to another medicine. And you're going to be thinking, well, wait a minute, Noble. Didn't you tell me in one of these other videos about when I talk about how these medicines work and how they affect the brain? I mean, yeah, there's a few nuances, but they still have this very similar, interactions, or they still have very similar effects in the brain. Why on earth would changing to a different medicine make a difference? Listen, I'm not exactly sure why it happens, but know that changing to a different medication can at times lessen the appetite suppression your child is experiencing, and you can stabilize their weight to some extent. So don't be afraid to consider pivoting, even though it's counterintuitive, and considering a different medication option. Even if the side effect profile is the same, because sometimes it works. If you've experienced any of these problems of appetite suppression and you've tried different medications and you've had some success with more with some versus others, would you put that in the comments? Would you share that with us? Like, I was on this medicine and I found it had less effect on appetite than this medicine. I want everybody to start a conversation. I want us to start thinking about this. So if you have a moment, put that in the comments. Okay, now let's move on to tip number 3. Tip number 3 is dosing. Now listen, your child came to the dose that they're on, honestly, right? Nobody says to a child, I never say to a child when they walk in, I don't like suck on a toothpick, just kind of eyeball the kid and be like, 72 milligrams of Concerta, bam. Nobody starts at the highest dose in a kid. None of us are trained to do that. None of us want to do that for your child, right? But based on experience, we're going to start at the lowest and most effective dose. The lowest dose is often, the best place to start. 0 medicine is best, but if you have to use a medicine, we'll use the lowest dose possible, but it has to be the lowest dose possible to get effect. We're not prescribing vitamins. Okay, I'm not prescribing Tic Tacs so that your child can have healthy breath. I'm prescribing a medicine that when it's effective, it's going to be likely accompanied by side effects. So know that when we start low, if you don't have any side effects, it's unlikely you're going to have effects, and we're going to increase the dose. So your child came to the dose they're on honestly. And sometimes you get to a dose and the appetite suppression is severe, and you feel like you've kind of crossed over a threshold, and now you're mainly dealing with side effects, and you may have left the benefits behind a little bit. It's not wrong to go back down to the next lowest dose because you already know what that dose was like. You already experienced it. If you're taking the stairs in a high-rise apartment complex, and every floor you go up, if you're like me, you're gonna have to sit down for a minute and take some breaths. So you're going to know what the lower floors were like because you had to take a minute to be there. So if you know that 72 is too much because it's crushing appetite, maybe think about going back down to the next lowest dose. It seems like you're going to take a step back academically, but what I want you to understand is that doesn't always happen. That doesn't always happen. So don't be afraid to step back. And if your physician isn't willing to entertain that option, or it doesn't bring it up, it's okay for you to bring it up yourself and to say, look, I thought we were just as good on the lower dose. Can we try that? That's not bad. It's not wrong. It may not work, but it is certainly worth a try because at the end of the day, it's less medicine. I want to add one quick point here in the opposite direction. Sometimes people say to me, well, the medicine's not working very well, and I'd like it to work better, but my child is experiencing pretty severe appetite suppression. And then I'll do something counterintuitive to the family in that moment, and I'll increase the medicine. I'll increase it. And they'll say, whoa, 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 Noble, whoa, whoa, whoa. Why would you increase the medicine if they're already eating so little? They're eating nothing, Noble. They're going to eat less than that if you increase the dose. And then I say to them, listen, I'm not a mathematician. I'm certainly not a genius. But my general sense is you can't take nothing. You can't take something away from nothing, right? You can't fall off the floor. If your child's eating nothing and we're getting some benefit but not quite enough, increasing the dose is not going to affect their appetite anymore. Right? You're still going to have the same conversation about it, but if we can get the benefit of the medicine, we can deal with the appetite suppression by understanding the things we've discussed in this video and in the things we're going to discuss in the next video. There's other ways to win to keep weight on, but first we have to establish effect. Let's get this medicine to work, and then we can deal with the side effects of it through other alternate strategies. So if your physician increases the dose, even though your child's not eating well, don't think they're going to melt away. Okay, they're not. They're eating nothing. They're not going to eat less than nothing. So, Billy go gruff. Let's move on to our fourth tip today, and that is augmentation. Now, augmentation basically means that you add a medicine to a medicine to offset the side effects. So if you're on a medicine that's suppressing appetite, like an ADHD medicine, this tip would basically say that you should consider augmenting that medicine with another medicine that would increase appetite. This is probably my least favorite strategy, and honestly, I don't use this very often, and it's just my preference. It's not bad and it's not wrong, but it's something that I just don't like to do because you're adding medicines to fix medicines. But to be fair, these kinds of strategies are common in the field of medicine in general, and just because people offer it, it doesn't mean it's bad or wrong. An example of a medicine that would increase appetite in the context of another medicine that's decreasing appetite would be cyproheptadine. That's a medication that affects the histamine pathway in the brain. It can often enhance or increase appetite. But you know, it's a medicine. It's a medicine. So you're treating a side effect of a medicine with a medicine that probably also has its own set of side effects. So it's a proceed with caution tip. Okay, before I get to my bonus material, let me give you a quick disclaimer. I'm a physician, yes, but I'm not your physician, okay? These opinions that I'm giving you in this talk are just my opinions based on my medical experience. If you have questions about these interventions, you should talk with your regular doctor about this. Okay, now let's get into bonus material. Now, as I said earlier, I've been on all these medications, okay? I know exactly how they work and how they make you feel, and I'll have to do a video sometime about how I got put on them and how I took myself off of them and why. I think that's an important video. But what I want you to understand is just because I'm not taking them now doesn't mean they're bad. These medicines really changed my life. I mean, they really, really helped me understand how impairing ADHD can be. And so I don't want you to think that because I no longer take these medications that you should get your child off. I'm not saying that. What I'm saying is that there's a time and a place for these medications, and there's also a time and a place to stop them. Okay, bonus number one. You stop these medicines when you hate what they do to your child. I'm going to say it again, you hate what these medicines do to your child. What do I mean? These medications can be very withdrawing. Okay, I talk about that in another video. These medications can cause a child to make less lateral movements in life and really just kind of walk in a long, dark hallway of productivity for 4 hours or 6 hours or 12 hours until they get to the exit sign and finish the work that's in front of them. It can sometimes diminish their spark. Sometimes, not only that, but they come from school and they just get really irritable and explosive because they haven't eaten all day and they haven't drank enough. Their eyes are dry because it's just like they're like machines, like they're focused. And you have to look at the situation and say, you know, there's a difference between helping my child be successful in school and stripping my child of their spark. And if you don't have a provider who helps you understand that, find one, because it's easy for us to see. And I want to encourage you to trust your gut on those issues. When you don't feel peace and the juice isn't worth the squeeze, that's a good reason to quit. Bonus number 2. Think about stopping a medication when you've seen all the floors, okay? If you go up all the floors of a high-rise building, you get on the top, you get out, you take your photos, you look around, you do an Instagram reel or you do something crazy, and you're done. Okay, there's no more floors, there's nothing else to see, you might as well get back in the elevator and go back down. Okay, when you're on the maximum dose of a medicine, that is as good as it's going to get. Okay, it's as good as it's going to get. And if you get there and you don't like the view, you just don't feel like this is worth it. And again, not to recycle, but the juice isn't worth the squeeze. You know, it's a good time to just maybe throw in the towel. Say, you know, let's just slowly land this plane. Let's go back down slowly. Let's come off this medication in a logical manner. Okay, the last 3 bonus tips I have for you are all based on metrics, okay? Now, physicians love metrics, right? Because they're objective. A metric it's a number, it's a value, it's a measurement. It's not a lot of subjective material, it's objective material. It's like you can't really debate with the things that I'm going to tell you next, but there is some subjective interpretation of them. The first of which is body mass index. Body mass index, okay? There's a chart that oftentimes you can ask to see when you're in your primary care provider's office, okay? And it's a standardized chart. It has these little growth curve lines, not unlike a growth chart, but it's a measurement that looks at weight as it relates to height, age, and gender, okay? And it comes up with a number. And that number plots quickly and easily on a graph. And once you start approaching a body mass index of 13 or less, I want you to understand that somebody like me is going to notice that and maybe consider making some changes. So if you see that happening, you might want to raise some questions. And you should ask to see growth charts in the clinic. Now, to be fair, some people are small. Some people have a body mass index of 13, 14, 15. They're just walking around. They're just living their life. So it's not a hard, fast rule, but if you've plummeted to a body mass index of 13, it's probably time to downshift and get off that medicine. The second metric I want to talk about is weight. And by weight, I mean, percentage as standardized based on age and gender. So when you're at or below the 3rd percentile for your weight, that's concerning. But again, the same rules apply. If you've lived your whole life at or below the 3rd percentile, the metric is not, oh no, they're at the 3rd or the 5th percentile. Noble told us we should stop the medicine. The metric is, yeah, but are they following their growth curve? Okay, if it's the 3rd percentile, fine. If it's the 5th percentile, fine. But my point I'm trying to make to you is, if they've plummeted down to the 3rd percentile from a higher level, like let's say they've crossed 2 major percentile lines, which is the 3rd metric I want to discuss. If they've crossed 2 or 3 major percentile lines, so from 50th percentile to 25th to 10th, 75th to 50th to 25th, these are major bolded percentile lines on the growth chart. If they're plummeting, crossing those, heading down to that 3rd to 5th percentile range, those are good reasons also to consider discontinuing the medication. Lastly, if you want to know more about the stuff I'm talking about, watch the other videos. Okay, maybe they're kind of goofy and the production value is low and I'm working on it. But my point is, I do give you good information. And I want to lastly thank you for your time. You have lots of choices and you chose to spend it with me, and I want to thank you for that.